As we mentioned, President Biden says the U.S. has reached his goal of 200 million coronavirus shots. He made the announcement Wednesday on his 92nd day in office. That's more than a week ahead of his target date. Despite this milestone, the pace of vaccinations in the U.S. has slowed in recent days. And as top officials combat vaccine hesitancy, a new report suggests supply could soon exceed demand. Adriana Diaz has more from Chicago.
Tonight, COVID infections remain stubbornly high, even with a third of adult Americans fully vaccinated and more than half with one dose. Just 5 states account for roughly 43% of cases nationwide. Many others are like Illinois, with cases down, but hospitalizations and deaths up. Now health officials are concerned the pace of vaccinations may be slowing down, giving the virus more opportunities to mutate and spread.
We're very soon hitting that wall where everyone who wants to get vaccinated will have gotten at least one dose.
A new Kaiser Family Foundation analysis projects that enthusiasm to get vaccinated may peak in the next 2 to 4 weeks.
Unless we can convince more people who are sitting on the sidelines now, we're not going to have enough people vaccinated to hit herd immunity.
Complicating vaccination efforts, a new FDA report out today found unsanitary conditions at the plant that produces the Johnson & Johnson vaccine. The plant remains closed, and J&J's vaccine rollout is still on pause after reports of rare blood clots are under investigation. To sway more people to get vaccinated, President Biden today urged companies to give workers paid time off to get a shot and proposed a company tax credit.
No working American should lose a single dollar from their paycheck because they chose to fulfill their patriotic duty of getting vaccinated.
How many boxes?
Those are the people Pastor Autry Phillips, handing out food here in Chicago, is trying to reach, an effort complicated by the J&J pause.
In the last 2 weeks, I would say maybe 10 people, 12 people that actually use J&J as an excuse.
And these are people who now may not get vaccinated.
Exactly, but with the work that we're doing on the street, we're believing that we can turn that around.
Home nurse Verna Keys wasn't swayed. What did you think when they decided to pause Johnson & Johnson?
I thought that something was wrong, and that's why I didn't take it.
Did that make you more skeptical?
Yes, it did.
Here at Chicago's Rush University Medical Center, vaccination appointments were fully booked until late last week. But this week, demand is down by more than 15%. Lana?
Adriana, thank you. Dr. Richard Besser joins me now. He is the president and CEO of the Robert Wood Johnson Foundation, as well as the former acting director of the CDC. Always great to have you on the show. So President Biden says that the U.S. is on track to reach his goal of small gatherings on the 4th of July, as long as we don't, quote, let up. What needs to happen between now and then to achieve this goal?
Well, you know, I think it's exciting, Lana, that we're at that point of 200 million doses. But there is still a lot more work to be done. There are a lot of people who have either decided they don't want to get vaccinated or they're only going to get vaccinated if it's easy. So the more we can do to reach people where they are, to make it as easy as possible, to get friction out of the system, the more we will see people getting vaccinated. But, you know, the 4th of July, when people, yeah.
Oh, sorry, because on that point, there are concerns that some working adults are choosing not to get vaccinated because they cannot afford to take time off to recover from side effects. I'm wondering if you can remind us how big of a concern that needs to be for people in terms of the typical effects and recovery time, since you were mentioning specifically that issue that people are increasingly not getting vaccinated, at least you're hearing, if it isn't going to be easy for them.
Yeah, I mean, that's a challenge in our country. You know, at our foundation, we give people paid time off to get vaccinated, and they've got the time, if they were to have reactions where they can't work the next day, where they could do that and get paid. But as we've seen during this pandemic, for many people, not going to work for a day means that they're not putting food on the table, and they're short on their rent payment. So that is a real concern in America. Hopefully, with the dollars that were put in people's pocket with the American Rescues Act, there's a little more wiggle room around that, and so that people can make it to get vaccinated. But you still want to make the vaccine delivery site as close to people's homes or to their place of work as possible. so that it is easy. And when you think about groups that are hesitant, those groups that have less demand, you can't treat them as one big block. You have to break it down and understand why different groups are not interested. So young people, for instance, have a much less interest in getting vaccinated than people who are older. And that may relate to having lower risk of having severe disease. So how do you reach young people with messages of, when you get vaccinated, you help protect those who are older, who are at risk, who maybe can't get vaccinated. You help reduce the chances that a new variant will spring up that vaccines won't be able to cover. Young people have a role to play in that. And can you play to their desire to keep their family, their parents, their loved ones who are older safe? When you look at people who are politically conservative, how do you reach them with messages that this isn't something that's being done because the government says it should be done? It's something that's being done because it helps you protect your family, your community, the ones that you love. And for people of color, thankfully, we're seeing the gap between people by race and ethnicity going down by reaching people with their concerns. But a lot of people don't have trust in our medical system and our public health system because of historical experiences of being disrespected, of not being treated well. So you have to break it down and reach people, understand what's driving people's level of demand, and go at it it's going to be a much slower pace than we've seen before.
Very well considered points on that, Dr. Besser. There's also a report from the Kaiser Family Foundation that says in the coming weeks that the U.S. is likely going to see vaccine supply actually exceed demand. We haven't been in that position before. I wonder about your perspective on that, and how else do we need to be trying to keep enthusiasm high for people who haven't gotten the vaccine yet? Is the message to anybody out there who hasn't gotten it yet that because they were waiting their turn, it's your turn now?
Well, that's the first message. Now in America, everyone is eligible to get vaccinated. So, if you've been waiting for it to be your turn, it's your turn, and that's just great. When you think about the supply exceeding demand, that was something that was predicted to be happening around this time, and it will vary by state. In some states, it's still a little challenging to get appointments. In other states, there are plenty of appointments, and there aren't as many people who want to get vaccinated. These numbers that we've been seeing of 3 million people being vaccinated a day, those are going to go down because the vaccine enthusiast pool is finally reaching the point where they're all getting vaccinated, and it then transitions really to door-to-door activity and grassroots activity, and people reaching out to their friends, to their family members, and explaining why they got vaccinated and why they encourage other people to get vaccinated. Our children in America are not protected by this, and thankfully, they're less likely to get hospitalized and to die, but there are thousands of children who've developed a very unusual multi-inflammatory syndrome that's very serious, and we don't know the long-term consequences. So, if for no other reason but to protect our children, we need to encourage people to get vaccinated.
I want to talk more about the kids with you, but before we leave this point, just a question. What happens when we have excess vaccine? Does that get set aside then, or redirected to places that perhaps still need more vaccine, or set aside as we are waiting for approvals for younger Americans to also start getting the vaccine? Or does the vaccine get shipped off to other countries and other places of need? What happens to all that?
Yeah, there are different approaches that could be taken. I fully expect that the government will hold and reserve enough vaccine for every person in America, and so that would include vaccines for children. Beyond that, there's no value in us holding on to vaccine. And there's every reason for us to want to share vaccine with other countries around the world, because wherever COVID is transmitting, new variants can arise, and if new variants arise, they can be variants for which the vaccine is not effective. So I would hope that once we have enough vaccine for every person in this country, we will share with the rest of the globe. It's the right thing to do for so many reasons.
And then my very last question, as I promised, I want to get back to that question about kids, because you recently wrote a piece in USA Today, and in it you argued that one of the biggest challenges that the U.S. faces in our path to herd immunity is, in your words, the failure to properly consider the needs of children. Talk to us again about how we need to be achieving herd immunity, not only to protect children, but what role those children have in our path to herd immunity.
Yeah, you're hearing less and less conversation about herd immunity because there's a recognition that until there's vaccines for children, we're not going to get to herd immunity. We're not going to get to that point where the virus stops transmitting within the community without other measures in place. And so it's really important that people understand that we need to wear masks and social distance and wash our hands until everyone has that opportunity to be protected. Children in schools, thankfully, they can go to school and they can learn safely if other measures are in place. But we do need to recognize that those other measures have to be in place because children are not going to be able to be vaccinated for some time. Hopefully, in time for this fall, we'll see vaccines for middle school and high school kids. But elementary school children, it'll be later. The predictions are will be early 2022 before those vaccines have been approved for use. So it's important. It's important that we're seeing the same disparities play out among children that we see in adults, where Black, Latino, and Native American children have been affected at much higher rates. We see the same disparities playing out in terms of children in school and their educational opportunities. Thankfully, there's dollars coming from the federal government to address the needs in schools, but we need to make sure those dollars are getting to the schools that need it most, so that every child has the opportunity to learn in person and have their needs met until there's enough vaccine for everybody.
Dr. Richard Besser, thank you.
Thanks so much, Lana.